Welcome to Vital Signs. I'm your host, Jen Gaudet, sharing what's real and relevant in healthcare, wellness, and peak human performance, empowering people to take control and advocate for their greatest asset, your health. Remember, this show is for educational purposes only. It is not meant to be construed as medical advice. Remember, always check with your practitioner before changing your healthcare routines. Let's bring up our first guest. You are in for a treat. I have a real special guest for us, Dr. Badia. He is an orthopedic surgeon, founder of Ortho Now, the very first network of orthopedic walk-in centers that provide timely and expert musculoskeletal care. He is the author of Healthcare from the Trenches, a candid expose on the actual causes for the United States healthcare inefficiencies. He has led a podcast. He is truly an expert in the space, and we're going to dive right in. Welcome to the studio, Dr. Badia.
Thank you very much, Jen. Pleasure to be here.
Absolutely. So I'm going to just start with healthcare has become increasingly fragmented. Our trust, in healthcare in general, is at an all-time low. Doctors and healthcare professionals are burned out, and compassion fatigue is also at an all-time high. We're sicker than ever. And you have come up with some real solutions. You've written a book, you have a podcast speaking about how can we fix and really save this broken healthcare system. Tell me, how did you come to the conclusions? How did you come up with your 7 solutions to save the healthcare system?
Well, I think before you can fix something, you have to understand the problems. And the goal of the book isn't necessarily a solution or a quick fix for healthcare. It's really bringing forth the problems and the issues to the public, because I really think they're not aware. But you speak to anybody who's practicing medicine at all levels, and I think we know what the problems are. So the idea of that book was to bring that, and now with the podcast that I have, and of course some recommendations in the last chapter of the book, there's a number of ideas that certainly we can explore.
You know, some of your ideas, I took a look at them. Some of your ideas could be construed as a bit controversial in the space because, as we know, our healthcare it's lobbied, it's politicians making decisions for us, it's healthcare administrators making decisions with us, it's for-profit insurance companies. You're tackling a big beast. So we did get to this over a period of time. Tell me, what do you think is the first thing that people really need to know so that they can advocate and they can speak to their politicians and make this change happen?
Well, I think the overwhelming problem is there are too many hands in the cookie jar, right? There are way too many middlemen in healthcare. And frankly, most of them don't add a lot of value. I mean, in the end, what you need is the patient and you need a clinician, okay? And anybody who stands between those two people are really detracting from the goal and probably adding cost and time spent in that equation. So one good example would be this concept of authorization, which is really an absurd concept when you think of it. I mean, who should be authorized to make healthcare decisions? A person with the most education and training, right? So that would be one example of minimizing middlemen, and that would save real money. I mean, real money, save hassles. I mean, you just have to ask the public, how frustrating is it to go to your doctor and you have to now wait for your insurance company to approve something? So years ago, the insurance company just collected premiums, lots of them, made a lot of money, and then they paid out for the care. Somewhere along the way, we allowed them to actually practice medicine by making decisions.
And let me ask something, because something else that I've listened to a few of your episodes, I've looked at some of your work, and something that's really top of mind right now is caregiver burnout, physician burnout. Physicians are leaving the industry at record pace, and a lot of times when you speak to them, it's prior to when they normally would have thought they were going to retire, and it's because of the mountain of paperwork. It's because they don't have the time, or they're not able to provide the quality care, and it's frustrations with the system as it is. So tell me a little bit about that provider standpoint And how did it get to this point? And what are the first small steps that maybe we could start to advocate for so that we can move this forward in a positive direction?
Well, I'd like to start by saying that I would like to diminish that term of burnout. Burnout usually implies that you're overworked, that you're not resilient, you can't handle the load. That's actually not the case. I mean, if not, people wouldn't be able to get through residency, right? Which is years of minimal sleep, a lot of work. That's not the problem. The issue with physicians is the loss of control, and that is frustrating to people. And the better term, as quoted in one of the chapters of my book, I start with this. Simon Talbot, who's a plastic surgeon at Harvard at the Brigham, coined this along with his the co-author, and they termed this moral injury. Moral injury is akin to telling a 19-year-old to go into this battle and kill the enemy, some strangers, and that causes a huge amount of stress for our servicemen. And it's very similar in healthcare, where all of a sudden physicians are being told by people how to practice and and restricting their decisions. So that is really what's causing the problem. Burnout kind of insinuates something else, I believe. The other thing is, I'd love to get away from the term provider. I understand the insurance companies need a broad term for nurse practitioners, PAs, physicians, but doctors are doctors, and nurses are nurses, and PAs and technicians are. So each of us has a title. This sort of broad provider thing is really disarming to clinicians, to be honest.
Yeah, you bring up a lot of really, really key points, and we now know there's been a problem. It's been going in the wrong direction for quite some time. I'm honestly not sure how it got as bad as it has gotten, having come from healthcare myself. But I just am curious, how do we raise awareness of this? How do we shift that? It has to come from an educational standpoint. So where in the education process for our doctors, for our practitioners, and then where in the education process for the public to take control of our health again in that decision-making process, so we can stop that moral insult, that moral injury that is occurring?
Yeah. Well, this is a great start here, Jen. I mean, shows like this that hopefully we're going to get a broad reach on this. The problem is that the public, there's a lot of distractions now. I mean, if you just look at social media, I always say I and many other clinicians try to educate patients about these issues or specific clinical entities. But the reality is, you post a video of a cute kitten or something, you get 1 million views. So the question is, when is the public going to actually care about this? When is the problem going to be bad enough where we reach what I've started to call, and this can be a controversial phrase, but I can't breathe. When is the I can't breathe moment coming for the public, where they care as much about healthcare and about the loss of control that us clinicians have over your healthcare? When are they going to care enough as they do about racial issues, or I don't know, the environment, or saving the whales? I mean, there's all these things that the public really gets behind, and I'm kind of baffled as to why they're not more upset. Because I hear it from my patients, but they're upset on a micro level, right? When it happens to them, they're not upset about the fact that this is a pervasive issue, that it's now almost 20% of our U.S. GDP, our domestic product, is going into healthcare, twice as expensive as the next industrialized country on the list. What's it going to take? And then the other thing is, us clinicians need to care more. I think us physicians are very focused in their work, as we should be, but I think we have to take our head out of the sand now and start pushing back. And that is happening, and I'm happy to give examples of that.
Yeah, I recall it being very active in the late 1990s, early 2000s, and it's almost as if that has shifted away over time. We do have to take a brief break, but you guys want to stick around because we're going to talk about how to solve this problem. What are some of the real things that we can do to resume advocacy for our healthcare, so that maybe we can bring down costs and actually move forward towards that peak health and vitality that we all want. We will be right back after these messages. Welcome back to Vital Signs. We are here with Dr. Badia talking about what has happened to healthcare. Why is it so expensive? Why does it take so long for us to get the care that we want? Why do we have to face advocacy? Why do we have to speak up? How do we speak up so that we can actually get the care that the doctors that we go to are recommending instead of jumping through all these hoops? Before the break, Dr. Badia, we talked about we really need to have awareness of what's happening and how we can advocate for ourselves, how we can communicate as both a patient and as a healthcare provider. I know you don't like that term, but let's just call a spade a spade. That's what they've turned it these days. So give us a real example about how maybe healthcare doctors, other healthcare providers are able to take action and to start advocating for themselves. You intimated that you had some real examples of that. And that would be really beneficial for anyone who's watching so that we can join this movement so we can actually take back control of healthcare and get back to being healthy, peak performing human beings.
Well, I think that physicians have to push back on some of the reimbursement issues, and that's also a terrible term when you think about it. We use this all the time in healthcare. We're just paid. Why we're not reimbursed? Reimbursed means that if I lend somebody $20 and they give it back to me, that's reimbursement. But when I'm providing a skill that took me and other doctors, a decade and a half to hone, we should be paid for that. It should be paid fairly. And what's happening, for example, in our own government with Medicare, right? CMS. This will be almost the 20th year in a row where we've been cut. Our payments are being cut. I think it's going to be this year again 2.7%. I mean, I know of no other profession or job where year after year they're being cut. So what's happening is, as you suggested, Jen, is that people are retiring early. And I'm working. I'm doing a lot of other things that you know about, but in terms of actually seeing patients, I'm seeing many less than I used to, for that reason. You can only push people so much. So, question is, when will other people opt out of Medicare, which is something I did last year, and I didn't really want to do it, but I felt I had to make a statement. And I also went at what we call out of network, meaning 10 years ago I said, you know what, I'm not going to allow Blue Cross or anybody else to determine, what my fees are. Here's my fees. I'm, willing to be paid a percentage of that. But I think if all doctors collectively said, enough, we're not going to accept these absurd payments. But the problem is we have to get together. And as I mentioned in the book, the competition with doctors started all in organic chemistry, usually sophomore year of college.
Yeah.
And, it's very competitive to get into med school. And I think that mindset continues many times throughout our career, but it's actually hurting us at this point. And I really believe that the rest of the healthcare ecosystem knows this and is, taking advantage of this fact that they know that it's very hard for doctors to get together and collaborate. But I think the time has come.
I would tend to agree with you. I mean, there have been research that's come out that suggested even that the United States public has 50% trust in our physicians and our doctors right now, that our trust has gone down. And it's not because of what our doctors are doing or not doing. It's because of the system. It's because they might be given a care plan or suggested a care plan, and then all of a sudden that's not what care they receive. And it's eroding consumer confidence in our healthcare practitioners, our physicians, to pick your discipline in medicine. At the same time, we're not able as healthcare providers. I was a healthcare practitioner. I was a physical therapist by trade. We were getting dictated what we should do, and actuarian medicine isn't what athletes need. They're not the 50 percentile, they're the 99 percentile, or the top 1%. And so the treatment plan looks very different for different people. It's different for a child as opposed to a geriatric citizen, but we seem to be putting everybody into a box and dictating how providers, how doctors can treat their patients, and how patients can get treated on the other side. And it's created a lot of communication issues, billing issues, so many confusions and inconsistencies. And then what I have noticed, and I'd love to hear your take on this, because I think what we need to do as like our doctors and in all of the specialties, we need to stop this taking away and everybody taking their little piece of the pie, and instead look at it as patient-centric. And okay, this patient needs A, B, and C. I don't want to take more and push away. We need to come together in a way that this patient gets the best care the first time, the right time, so they can continue to move. What do you think about how compartmentalized medicine has become, and how do we solve that problem if we are a healthcare provider, so that we can provide that more patient-centric care in a holistic way?
Well, we mentioned about authorization, right? When you're having people who don't understand the clinical problem making decisions standing in a way, it actually paradoxically drives up costs. I know that the intention is to limit, and certainly we want to minimize overutilizers, minimize waste, but it ends up working against you. So what I think is more important is that we should have oversight, right? So we should have oversight because there are going to be outliers, and that's not difficult to do. And I wouldn't blame an insurance company or any entity, whether it be our government, is to have oversight. But when you stand in the way every step, that ends up prolonging the care and actually driving up the cost. So one way to do that is to, and I think it's starting to happen. I mean, there are some positives that we can point to, is that I think some of the insurance companies are starting to do away with this pre-authorization. And there's a whole movement. There's a hashtag pre-authorization that you can post. So that would be one thing. The other thing that I think we have to keep in mind is there's so much more to know in medicine nowadays, and that's a good thing. I mean, there's so much more we can do. I'm reading a book now, about the origins of gene therapy and CRISPR and RNA, et cetera. I mean, there are genetic diseases we're going to be able to cure, but there's so much more to know, that this concept of making patients kind of go to their overworked primary care physician to thinking that this saves money, paradoxically, it actually is more expensive. You should be going to the right specialist at the right time. And I say the right time because when you delay care, and we know that for cancer, right? Anytime you delay care, you're gonna not only impact the clinical result potentially, but you're going to drive up the cost. So I think right specialists at the right time is key, and that's the reason I founded Ortho Now, was because I started seeing as a hand surgeon how the average person who came to me had been to 3 or 4 places before coming to me, and each of those stops costs money.
Yep.
So that we have to hone in and get people to the right type of clinician, and let our primary care doctors keep us healthy and oversee our health, rather than stick them with all the minutia that really we have subspecialists for. We end up being actually cheaper, and we have to get away from this idea that specialists are expensive. That's really nonsense.
Yeah, and I couldn't agree more. I mean, if I'm in an athletic event and I go down, I know I've already torn my ACL or had a knee injury. I don't need to go to my primary doctor before I go to see someone who specializes in the knee. I know that I injured my knee.
And you wouldn't see me. I'm an orthopedic surgeon. Yeah, I mean, I've done ACL reconstructions, but it's been 30 years. I want to say, my buddy who fixed my knee, because that's what he does every day. And if you have a shoulder issue or an elbow or wrist or something, that's what I do. So in other words, you got to get the person. And guess what? When somebody comes into my office with, lateral elbow pain, which is typically lateral epicondylitis or known as tennis elbow, it's amazing how many patients will come in already with their MRI, ordered by their primary care physician, and I'm just telling you that that's a waste of money. And any elbow specialist will tell you that you need a good clinical exam, and let us decide what tests should be ordered. We're ordering 50% more tests than in general in the healthcare system than we should be.
And our clinicians are trained, our specialists are trained in that physical assessment that
Right.
negates the need for a lot of these tests. I couldn't agree more. How can people find out more, read about this, and educate themselves if they're watching this and want to learn more about this?
Well, there's a ton of podcasts, Jen, as you know. I mean, I have to admit, I put mine a little bit on hold. Why? There's just been lack of engagement for the public. And at some point you say, well, if there's so few views and people aren't sharing this, it's like, what is the point? But fortunately, there's many other podcasts. I'm hoping to start mine up again, which is called Fixing Healthcare from the Trenches. But there's many books you can educate yourself about this. If I can give a shameless plug for mine, this thing doesn't, really make any money, but the Healthcare from the Trenches, I wrote it really for the public to understand what the causes are. I think just educating yourself is the most important, and you have to be careful because what you see on social media, a lot of people are putting in their 2 cents, and you're not always getting the most accurate information. So the public has to be, savvy on this issue. But there's certainly a lot of resources out there. The important thing is to care. And when you see something that's of interest and you learn something new, take a moment and share it. I know it's not as fun as a cute dog, trick or something. I watch those myself. But to share something, that's important because then we expand the net of people understanding, and we can finally do something about it.
Absolutely. Thank you so much. If you are watching this, pick up Dr. Badia's book. It is amazing. It really sheds some light on what's happened in healthcare and what are some of the things that we can do to advocate for ourselves, because if we don't advocate for ourselves, we continue in the same fashion. It just snowballs even more than what we've already seen. We do have to take a brief break, but we will be right back after these messages. Welcome back to Vital Signs. If you're just tuning in, you're going to want to go to nowmedia.tv, click on shows, and go to Vital Signs to catch the first half of today's episode. Why? We are here with an expert, Dr. Badia. We are talking about how do we fix the healthcare system that is so broken, either whether we are a patient or whether we are a healthcare provider. How can we move powerfully forward? So I'm going to dive right back in, Dr. Badia. This has been an excellent conversation. It brings awareness to our very real situation that has been there and has been getting worse for the last at least 20, 25 years. It's just been going in the wrong direction. And before the break, we talked a lot about some of what's wrong and some of the inefficiencies. And we talked about finding the right specialist, finding the right practitioner or healthcare practitioner the first time instead of going through a bunch of gatekeepers. How do we, if we are the general population, I'm a patient, I have an issue, how do we determine who's the best entry point for the situation that we're faced with in our healthcare?
Yeah, it's an excellent question. Certainly to the clinician, it may seem obvious, but I think you have to break it down and simply give it some thought. So, for example, I think we all know that if you have an eye problem, you're going to see an eye specialist, right? An ophthalmologist. I think we have to delve further in that. I do think that everybody should have a primary care physician, right? Somebody to oversee. Yesterday, I met with my internist. I discussed all the blood work that I'd had done some weeks ago, and that's important. But I can tell you that if I have a problem, I don't know, urinating, I'm going to make sure that I go to urologist, and I'm going to look into, does that urologist deal with that, or do they treat more, say, cancer? So I think the public, now we have all this access, right? We call it Dr. Google, but you have so much information. So I think the public has to take some responsibility, is to really try to find the right clinician for their problem, and that will save a lot of time, but ultimately will save money. So I think the right clinician at the right time, meaning in a timely manner, ends up saving a lot of healthcare dollars, and ultimately it's good for your health, right? Because there are things that if you're seen for them, and I think that's an obvious thing to the public, if you take care of something earlier, it's a good chance that you'll have a better outcome, right?
Absolutely.
So that requires that, and that's why it frustrates me a little bit when you see all these, whether it be med spas or general urgent cares popping up. I think there's a good role for that because you might need to get a quick, antibiotic for sore throat or something. But I think that does not replace having a relationship with your physician. Okay. And if there's something very focused, find the right person. Okay. So, I'm an upper limb specialist. You mentioned a knee injury that you treated a lot in the past as a sports physiotherapist, right? So I don't do knees, even though I'm an orthopedic surgeon, but I do a ton of elbow. So rather than going to two or three doctors before me, just go to somebody like me, and they're going to understand the elbow a lot better. And that, it sounds like a really basic concept, but you'd be surprised that people do not do that. I mean, super well-educated people, I see it all the time in my circle of friends, and they continue to do that. And maybe that's because they have a trust in general for doctors, and I think that's great. I mean, that's flattering. When I sometimes say to them, wow, you must really trust your doctor to go there thinking that they're going to know something about your wrist pain. A wrist is an incredibly complex thing. That's like asking me to understand why you're having right upper quadrant abdominal pain. I mean, yeah, I did a general surgery and internal medicine in residency, but I'm not an expert. So I implore the public to really try to find the expert. And I think one of the ways to do that is the development of specialty walk-in centers. Because when you have to get these approvals to go or get an appointment, which sometimes is weeks out, I think we're going to see more and more of that. And at least I've tried to do that in the orthopedic realm, is really allow people to walk or limp in and get seen by somebody who really knows about that. And if it's potentially surgical, boom, we use an app. My app, my Ortho Now app, has won 2 national awards for digital health. Now my challenge is getting more people to use it, right? So hopefully we'll do that, because now I have a company coming in that's going to expand it nationally. So I'm hoping to see that. But we can do that in so many sectors of healthcare. There's women's centers popping up, right? If a woman needs a pap smear or is having some dysmenorrhea, right, pain during unusual amount of pain, she may not be able to wait 3 weeks for her OBGYN. So at least let them get in the door, let somebody who is sort of an expert in that, and then they would immediately get referred to that person if they need more. That, I think, will really change the ecosystem and will save money, including for the insurance companies. But we need the insurance companies to engage in this. There is an incredible veil between the insurance companies and us so-called providers, and that has to change. Because I understand they're there to make money. We get it, and if we work together, we can help them do that while also delivering better care.
Yeah, so I completely concur with the idea of that one-stop shop. You've created that with Ortho Now. I think it's fascinating. You were in telemedicine before COVID, if I'm not mistaken, before the pandemic, and so this is something you have a craft you have kind of perfected almost within your industry, and I can definitely see that being the wave of the future. And I'm going to ask you to talk now about how do we change the education system, because as you said, I went through our organic chemistry too. You're in competition with everyone to get the few spaces to get into the program that you want, to become the physician, the specialist that you want to be, and the career you want to focus upon. So how do we foster from an earlier stage, or in medical school maybe, or maybe even before that collaborative rather than competitive approach? What do you suggest for that?
Well, I think having an awareness of it. I mean, I think you hit the nail on the head. There's no reason why it's harder in pre-med, for example, but certainly once you hit medical school or PT school or nursing school, there should be really programs where it is collaborative and you're doing team exercises to treat the patient. I don't know. I mean, you're asking me, how do we change a mindset? It's competitive because the reality is there's a certain number of spots and a certain number of people wanting to go into it. And hopefully, despite all these problems, hopefully we're going to have enough bright young people who are going to want to pursue a career in healthcare. Unfortunately, I may not have that with my two children who are teenagers, but that's kind of the common thread amongst doctors, is that their children don't want to go into it. And I'm hoping that in my lifetime, I see a reversal of that. And I think there is potential, and perhaps it's just having that awareness. And once you're, whether it be in medical school through residency, have sort of symposiums where you get together and you have more of a team approach.
Yeah, sort of like grand rounds, which you see in clinicals, but doing it earlier on, maybe during the more academic part of medical school, before you get to residency or internships or externships or whatever program you're in. I think that would be a really excellent way of doing that. Now, speak a little bit about once you're out. It's very competitive, and so I live and broadcast from the Houston network, Houston metro area, and so there's a lot of scarcity mindset, but there's not enough doctors, there's not enough specialists to treat the population. There's more people than there are healthcare providers to serve the people, but there's still a very competitive attitude when you get out, and it kind of continues this gatekeeping feeling, or that I want to do everything in my way before I send it out to a specialist, for example, or whatnot. How do we start the conversation in the actual working world so that we can become more collaborative? Because I've done a lot of conversations on the wellness side. We seem to be kind of coming together a little bit more, but I don't see it translating into the actual healthcare side. What are your thoughts there?
Well, the problem is, as they continue to cut us with reimbursements, it makes it really difficult. It makes it right, because I think when people are being fairly paid and compensated for their time and their expertise, a lot of those issues kind of disappear. In the prologue of my book, which I love, I mean, it actually brought me to tears when I read it. Dr. Julio Gonzalez wrote, it's 2 pages long, and he talks about how when you go into the physician's lounge at a hospital, it used to be that the discussion was always around, hey Joe, I've got this interesting case. I've got, middle-aged woman with this. What do you think? Now the discussions are God, they're cutting us again, and this EMR is now they're phasing it out. So there's all these other stresses that physicians have to deal with now, and we have to tackle those. And once that gets better, I'm hoping some of that will change. The problem is we're facing nearly 140,000 physician shortage in the next decade. But thank God for our mid-level colleagues, right? I missed a flight because of the weather, and on Monday I didn't see patients in my office, but my PA, shout out to Jessie Raya, who is very well trained. I mean, she's not doing surgery on her own, but she knows the hand, and she knows how to examine an elbow, and that helps a lot, whether it be nurse practitioners, physician assistants, nurse clinicians. I think we need that, because there's 330 million people in the US, and we haven't really expanded the number of medical spots. So I also think that we're going to open it up, and we'll see now the elections, but I think it's important for both sides of the aisle to understand that with immigration, we're going to have to let in more well-trained colleagues from other countries, and there's many of them. I mean, my practice and my academia is very international, and I would love to see some of these well-trained colleagues have the opportunity to come here, because we need them. We need them. It's you wait weeks and weeks to see a specialist, sometimes months, and that's really not acceptable. We don't want to become, we're the US. We're not a socialized system like Canada. I mean, I see Canadians who come down to sunny South Florida in the winter, and they come for care because they're put on waiting lists in Canada and the NHS in England. Yes. So we have a great system. I mean, I don't want to lose sight of that. We have incredible science. We have incredible dedicated physicians and nurses and techs, but there's too many middlemen. There's too many hurdles. There's too many hassles, and the decline in reimbursement of the people actually deliver the care is not lowering the healthcare cost. Let's not fool ourselves. We're not lowering healthcare costs by 3% by cutting the doctors in Medicare by 3%.
Absolutely. You've hit the nail on the head. We do have to break for commercial. Folks, pick up his book. We will be right back after these messages. Welcome back to Vital Signs. We are here with Dr. Badia talking about how do we fix healthcare? How do we make it more effective, more efficient? How do we bring down costs and really ensure that we are getting to the right specialist, to the right healthcare provider the first time so that we're able to get more efficient, more streamlined care. Dr. Badia, in the break, we were talking a little bit about we have elections coming up. How can we, what is the role of our elected officials in this conversation, and how can we as the public use our voices with our elected officials and vote with, use our votes so that we can make sure that our elected officials are going to move this forward in a way that makes sense for each and every one of us?
I think as the public brings this to the forefront, whether it be, again, with social media, writing your local newspapers, your congressman, if this issue is raised continuously, then the legislators are going to have to respond, because otherwise people will make their thoughts known with their votes in the next cycle. So there's no question that healthcare lately has been neglected as an issue. Certainly, President Obama brought it up and made a very valiant attempt to make some improvements. And I think we need to see just more of that. But we really have to make the right improvements. And to do that, we have to get clinical people involved in the dialogue. It cannot just be presidents of insurance companies and big healthcare systems and politicians. There has to be people who are in the trenches, right? In the trenches of healthcare to help, because we kind of know what the solutions are. It's just a matter of legislating some of them. So, an example I mentioned before is about pre-authorization. I think that there's a real movement in Congress to actually restrict that, to not allow an insurance company to be the one deciding when a doctor orders a test or a procedure or therapy, and the insurance company stands in the way. But to do that, the public, so people who are listening to this, really have to make the effort and write to your congressman. And let me tell you, when enough people write and say this is an issue that's concerning to them, they will listen. And every congressman and senator has healthcare aides. They have aides in different, for energy sectors, for transportation, and healthcare is a major sector, right? It's 1 out of every 5 US dollars. So I think getting the politicians engaged in understanding that we care about this will help. Now, there are 3 senators who are physicians, and one of them I have a great interaction with is Bill Cassidy. And Bill Cassidy from Louisiana is a gastroenterologist, and he understands the problem. His wife is a general surgeon, and I know that he cares about this. But if he and others, his colleagues, saw that the public cares about this issue, then we would see more traction. And that's what it's ultimately going to come to. And again, the best way to do it, it's very simple. Just click. You listen to this interview or any other one that's out there talking about this issue, share it. Don't a little like, a little heart doesn't mean anything. What really moves the needle is sharing things so that other people in your circle understand what the problems are. And I think that's what it's going to take.
Yeah, and I would even go a step further, and I would say, if you're watching this, if you're listening to this, and you're like, yes, we do need a change. I don't know anyone who thinks that our healthcare system is working properly. So if you're listening to this and you're like, yes, we need a change, start the conversation. Have the conversation at the dinner table. Have the conversation with your peers, your friends, your colleagues, because as we talk about this, people become more aware that yes, we have to take back our advocacy, and it's time for us to. We're doing education right here. Dr. Badia, you've been amazing talking about the issues, some of the things that we can do. Now's the time where we, the individual, have to advocate for ourselves. And we do that by reaching out to our legislators. We do that by using our voice, by empowering each and every one of you to take advocacy over your health. Your health is your greatest asset. after all. And so I'm going to ask you, Dr. Badia, we've covered a lot of different areas. Is there anything else that you really feel that the public could benefit from knowing so that they could write that powerful letter, so that they could advocate for themselves and actually move the ball forward?
Well, I think we have to move away from healthcare being a micro, issue that the individual or family issue you worry about, more to a systemic and community and societal issue. So that, because people get frustrated with healthcare, but then they don't really talk about it outside their own circle. Mm-hmm. It has to be discussed on a broader. So it really involves, hey, this is what happened to me. I tried to seek care and put that on your social media and get people to be aware of what's happening and that's happening to so many other people, so that something could really be done about it. To do that, again, legislation is key, but I think awareness, and it's amazing how things can change when society realizes that its citizens care about an issue.
Absolutely. You've been such a wealth of information. I really appreciate you coming here, speaking to us on this level, educating us and empowering us to take advocacy for our health. You have an amazing book. Please share once again for everyone who's there. If you are watching this and you want to learn more, how can we get your book? What does that look like? How can we reach you if we would like to learn more or be a part of the solution?
Yeah, actually, this week, it was actually technically very difficult, but the book is now on Google Books. So Healthcare from the Trenches, you can just, do a search. It's on Amazon. There's a Kindle version, so if you like to see it, you can read it on your phone. It actually looks surprisingly good. I'm old-fashioned. I like to read the book, so you can get that on Amazon, but you can get a digital version also now on Google Books. And I do have a little bit of news. In the next week or two, the audio version should be out. We're going to be doing it with AI, but if there is enough interest, I will probably take the time and read it myself at some point. So that's coming. But we have to see that there's engagement. And for me and so many other people that have written about this topic, when they see that the public is really reading it, that's going to empower us to do more, and then we're going to see a movement, and that's eventually what's going to happen. So yeah, Healthcare from the Trenches, Amazon, Google Books, and more importantly, give us some feedback. I mean, take 5 minutes and write an Amazon review and say, yeah, I've experienced this, and I agree with this, I disagree with this point that Dr. Badia made or one of his colleagues made in a book. Let's at least get engagement. And that's what we need.
Thank you so much for your time. I value your expertise. Thank you for joining us today.
Thank you. Thank you very much, Jen. A pleasure to be able to speak about this important issue.
Absolutely. And you, yes, you have been called to action. You heard it. Dr. Badia challenged you to advocate. Pick up the phone, write an email, write a letter to your legislators, talk about healthcare. What do we need to do so that we can really rein in the cost, really streamline things and get the care that we need and deserve. Each and every one of us deserves to be taken care of, and our physicians deserve to have the ability to do that as well. So your call to action is educate yourself, pick up Dr. Badia's book, listen to some podcasts, do what you need to do, but then have the conversation within your circle, have the conversation in public places, and let's actually start that movement so that we can become advocates for our greatest asset, our health. We can start that movement, that transition, so that our communities become healthier, because after all, that's what we're after. We want to become the most amazing, peak performing human beings that we can, so we can enjoy every other aspect of our life. We only get one body. We have to live in it for the rest of our lives. So let's take care of it and advocate for it. Unfortunately, all good things come to an end, including this show. But the good news is we will be here same time, same station next week. So until then, have an amazing rest of your day.
This has been a Now Media Networks feature presentation. All rights reserved.